today to this annual National Health and Safety Day in Mining. It's become a tradition. It's rooted in the history of our Kumbulikaya campaign, initiated to remind us all, and particularly the leadership of our industry, of the need to maintain an intense focus on the safety and health of our employees. Any measure of the effectiveness and progress of our industry must look at progress towards ensuring that every employee returns home as healthily and safely as they left home to head for their workplaces in the morning. In particular, we cannot countenance deaths of colleagues as a consequence of an accident or occupational health incident at work. And while we have made significant progress towards meeting that goal, we know we still are a long way away from achieving it. And as others have detailed shortly, we have seen a regression that we need to address very firmly. And you'll see that there are some significant collaborations amongst all the different stakeholders on looking at particular solutions. The last 18 months have confronted us with an additional and most profound health challenge. And I'd like to thank everyone present for the remarkable role that you all have played in saving lives and saving livelihoods. Government, organized labor, and the industry, every single worker. The heroes of this pandemic are the people that have been in the front line, going to work every day to keep South Africa's economy going and to keep us all safe from a frontline healthcare perspective. Before continuing, what I would like to ask all of you to do is to observe a 1 minute of silence for those who have passed away in the industry. So far this year, we've lost 32 colleagues, and in the last 18 months since the beginning of last year, that is 92 people who have succumbed to injuries sustained in mine accidents since the beginning of 2020. And I think we must also remember the 472 people who have become victims of COVID since the pandemic began. So without further ado, if we could just focus on 1 minute of silence, please. Thank you.
You're muted, Roger.
You're on mute, Roger.
I'm not sure who put me on mute, but whoever did, please don't do that again. So colleagues, we mourn their loss. Appreciate you taking that minute of silence. We mourn their loss and we recognize the pain of the families that have lost their loved ones. And in the midst of the sadness, there is, I believe, a real glimmer of hope. And we have, as an industry, done a remarkable job in working together through collaborative partnerships to protect our employees from the ravages of COVID-19 as far as this has been practically possible, working hard to save lives and to save livelihoods, and we will continue with this. But the way forward for us as an industry and as a country is to achieve community immunity through vaccination. And I've got to say, when we look at the numbers from the rest of the world, if you look at last week in the United States, 99% of new COVID cases in the United States are in people that are unvaccinated. So with the National Department of Health and the trade unions, we have embarked now on a truly groundbreaking endeavor that will help save many hundreds of lives that the pandemic would have otherwise taken. I talk here about the mining industry's contribution to the national vaccine rollout. To date, 58 mining occupational health sites have applied to register as primary vaccination sites. A number of others will operate as secondary sites. And our goal is to ensure that all employees are able to be vaccinated as soon as national policy and the availability of vaccines makes it possible. What I will say is the criticality of government helping us to, I wouldn't say regulation light, but to for the registration of these occupational health sites, to see how we can compress the process to get as many of our sites registered as quickly as possible, so that when the vaccines do become available, you know, we are able to get out there and really do what we want to do, which is to help the nation. 6 sites have already begun vaccinating. Another 8 will begin shortly, and we're working closely with the National Department of Health to expedite the registration process in terms of mining sites as soon as possible. In fact, we are seconding some staff members into a process to accelerate the registration of these sites. So subject to National Department of Health approvals, some mine vaccination sites may extend their services to employees' families and others in the surrounding communities, or provide support to community vaccination programs. And I think this is really important. I just hope that all our sites are actually opened up for this particular purpose, because as we said before, this is all about how we get the nation vaccinated. And as mining, we want to play our role, and this is truly a critical endeavor. I appeal to us all, my fellow industry leaders, our leaders in the trade union movement, our leaders from the Mine Health and Safety Council perspective, and from the DMRE and from the National Department of Health, to do all that is possible to persuade those who doubt the efficacy of vaccination programs that they and their families' interests will be best served by being vaccinated at the earliest opportunity. I mean, what person wouldn't allow their child, for example, to be vaccinated against mumps, measles, and rubella, the so-called MMR jab? I think this is exactly the same. So we must ensure that all employees have the time and opportunity to take those opportunities for vaccination that will come as the vaccinations are made available to us through the government program. So, ladies and gentlemen, I thank you all. Really appreciate you attending.